Osteoporosis. Okay, so just to introduce ourselves. So I'm Shaina. So I am the clinical director of the Franklin Square Neuro Rehab Center. It's a part of New York Physical Therapy and Wellness. They have 13 locations throughout Long Island, but only 2 of the locations specify in treating patients with neurological imbalance conditions. So one is in Franklin Square, the other one is in Babylon. And what we mean by neurological physical therapy is I specialize in walking, balance, treating patients who have Parkinson's, multiple sclerosis, strokes, brain injuries. And then a subspecialty that I do is I specialize in dizziness and vertigo, which is what I gave the lecture on last time. So I worked at NYU Rusk for 6 years, moved back to Long Island, worked at Glen Cove in their traumatic brain injury unit for 3 years, and then opened up this practice. That's me.
Did you ever work with Tri? You know Tri? I worked with Tri a long time ago. It's an organization that have people with, some kind of brain dysfunction. It could be that they were born that way, or it was caused by an accident. But their location, they train people to work in either they had 2 different offices, one for secretarial and another one to work in a factory.
Oh, okay.
And I was the one I was in the group that trained people to work in a factory. It was right in Garden City.
Okay.
Right
Okay.
You know where the bowling alley used to be? I don't know if it still exists. It was right over there.
Okay, we can get back. We can discuss that after the lecture, and we can kind of talk a little bit about that. Yeah.
All right. So I am the other speaker. My name is Brianna Knox. I'm actually an occupational therapist. I also work for New York Physical Therapy and Wellness. About 6 months ago, I was approached by the company to start an occupational therapy outpatient division there. Obviously, I had to say yes because it's a great experience, and it's just another way to give back to patients who need. I actually am certified in fall prevention. I'm a certified fall prevention specialist, and I'm also certified in Pilates rehabilitation, which helps people, connect more to their bodies, works on that core connection, and really helps overall strength and function. I've worked in outpatient my whole career. I worked originally for Metro Physical and Aquatic Therapy, which might sound familiar to you if you've been to therapy before, and now I work for New York PT and Wellness.
We're the dream team.
The dream team. So we'll get into what?
And I heard you work for New York Tech also?
Yeah, so I teach in their physical therapy program. Yeah, so I teach a couple.
In the 500 building, or
There's no more 500 building. Yeah, no, the medical school took over the 500 building, and then they made the libraries now the health science building. But yep, I teach. That's where I teach.
I'm just going to add something. Let's reserve all questions for the end so that we have an opportunity for the lecture. And then we'll reserve all questions to the end.
Okay. All right. So what is osteoporosis? So osteoporosis is defined as a skeletal disorder. So what's happening is your bone mass and your bone density are compromised, which increases your risk for fractures. Bone is a living tissue, so your bone is constantly kind of being regenerated. So your body is naturally kind of healing itself and rehealing itself over time. With osteoporosis, what happens is that process slows down. So it takes longer for the body to kind of reheal its bone and strengthen it. And over time, that makes your bones very brittle and at increased risk for fractures. It causes, I kind of said that already.
All right, so some facts about osteoporosis. Osteoporosis most commonly occurs in fractures of the hip, the wrist, or the spine. So specifically the vertebrae from the cervical spine, which is your neck, all the way down to your lumbar spine, which is your lower back. The vertebrae are actually the most prone to fracture. Actually 700,000 fractures a year from osteoporosis are spinal fractures. A lot of this can happen from simple things like a cough. So you can cough really hard and fracture a vertebrae if you are somebody that does have osteoporosis untreated. Osteoporosis is typically a disease that most commonly occurs in women. However, 1/3 of all of the vertebral fractures and hip fractures actually occur in men. So 44 million people in the US are at risk of getting osteoporosis, and 10 million people are living currently with osteoporosis. Another 34 million are people that are considered to have low bone mass, which is actually called osteopenia. It is a precursor to osteoporosis. So if you do get told you have low bone mass, that is actually called osteopenia, which is something that can lead, if untreated, to osteoporosis. The last fact is 1.5 million fractures in the US are the result of osteoporosis, which is a very high amount. Like I said earlier, most of them most commonly happen in the vertebrae of your spine.
So you guys ever heard of someone with like a compression fracture of their back? That is a fracture of the vertebral body. It's the most common with it. So that's what when they say compression fracture of your spine, that's what they're talking about. And they're painful, right? Yeah. And it takes like 12 weeks for it to heal, if that. I mean, it's very difficult. So this is it. Without the visual, this one doesn't help. I had a little picture of kind of how bone heals. It's kind of hard without the picture. So I'll kind of go into it a little bit. So you have natural bone, and then the body is naturally always resurfacing your bone. So these things called osteoclasts that kind of come in and eat away at like the bad bone and freshen it up. And then there are these mononuclear cells that come in and kind of replenish the bone to help the bone reheal. And then the osteoblasts grow and harden and become osteocytes. And that's how the bone heals itself. With osteoporosis, this is a much slower process. So it takes longer for the bone to kind of regenerate. And that's what kind of tends to leave the bones more frail. Okay.
So typical risk factors that could put you at risk for osteoporosis. The first one is age. Bone loss increases naturally as you do age, and the growth of new bone slows. So as time goes by, with age, you increase your risk of osteoporosis, along with a bunch of other things. I hear every day that I should not get older, but I always say the clock is ticking.
Yeah.
And I wish that was up to me. If you find the fountain of youth, let me know. The next one is sex. So females are at greater risk due to a lower peak bone mass. Lucky us. However, that doesn't put males are still at risk, especially over the age of 70. One thing that does happen with males as they age is once they hit the age of 65, they are already at prone for increased risk of falls. So what happens is if they have gone to the point where they haven't been told to get a bone density scan or told by their doctor that they should look into it, since it is less common, sometimes it can go under radar. And what happens is they will fall and fracture, say their hip or their spine, and then it'll be found that they do have osteoporosis or did, and then it's very hard to prevent it at that time. So even though females are more prone to risk, it is also important for males, if they feel something is off, to get checked. Better safe than sorry, I always say. Your body frame and size also plays a factor. More slim, thin bone women, that's the words of the article, don't quote me, and men are at greater risk. They tend to have less bone compared to those with larger bones in their structure. Race also plays a role. White or Asian women are at higher risk, and your family history. So if you have a parent or sibling that does have osteoporosis or even osteopenia, it puts you at greater risk genetically.
Right, so more risk factors. So again, this is one of the reasons why women aren't more increased, because of changes in hormones. As we know, when you go through menopause, it changes our hormones. And that's kind of one of the big things that they say as women increases your risk of having osteoporosis. So low levels of certain hormones can increase the chances of developing it. So low estrogen, again, going through menopause or changes and things like that, increases the risk of it. Low levels of testosterone in men. Actually, men have their own little menopause also, that as men get older, their levels of testosterone continue to decrease as well. So just like women's estrogen goes down, men's testosterone goes down. And that's why for both men and women, osteoporosis is a high risk. A big thing that you can control is diet. They tell you eat calcium, drink your milk, things like that. Orange juice now has calcium added to it. Also, one that a lot of people say, and I feel like goes really undetected, is vitamin D. There's a big push and there's a lot of research in the benefits of vitamin D and taking a vitamin D supplement, even in early age, like my doctors, I take vitamin D. It can really help increase
Isn't
the,
it D3 or something?
yeah,
There are
D3, there's a
different
couple.
types.
And this is
So-
all, again, talk to your doctor. Like this is
So
just general
typically,
information.
in women or men with osteoporosis, they have low levels of both calcium and vitamin D. And when you're low on both, your body cannot actually absorb the vitamin D without calcium to be able to create that hardened bone. So if you're low on one and not the other, most likely you're going to need to take both so that you can increase the bone density and actually allow the vitamin D to be absorbed by your body when your bones have enough calcium to support the bone. It's a whole,
It's like how the body kind of creates. It needs
Yeah.
one thing to help bring it to
The
another
other.
so that it can grow. It's like we're a ball
typically
of
when you're
chemicals.
taking vitamin D in this level, your doctor will most likely prescribe it because it will be a different dosage than one that you would buy off the counter, which is why you should talk to your doctor, get a bone density scan, and ask the right questions, which is why we're here,
We're here.
to give you that info.
Yeah, this is just little bits of info. This is not to replace any kind of medical advice from your doctor. So you should really, if you have osteoporosis or you have something, this is just give you information to go to your doctors to be like, hey, we went to this lecture. What do you think about this?
Yeah.
Another thing is other medical conditions and medications can increase your risk of osteoporosis. So endocrine issues because of the hormone disease, gastrointestinal issues, patients who have Crohn's disease or IBS have difficulty absorbing calcium and absorbing vitamin D and absorbing other nutrients that helps create bone. Certain types of cancer, HIV, and other types of like eating disorders. Long-term use of certain medications may make you more likely to develop bone loss and osteoporosis. So you just, again, have to talk to your doctors and make sure that that's not a side, if you're already at risk, increased risk of osteoporosis, that some things you're taking don't also increase your risk.
And one thing is with the medications, one thing does not trump the other. So therefore, I would not recommend anyone change anything about their medications without speaking with their doctor, because like I said, it's like if you take away one thing to add another, you're still could be harming your body in another way. So you have to make sure that everybody's on the same page, which is very hard these days with doctors, but you're your best advocate. All right, so lifestyle. Your lifestyle plays a big role in osteoporosis. A healthy lifestyle is important for keeping your bones strong. So factors that contribute to bone loss include low levels of physical activity or prolonged periods of inactivity, which can increase the rate of bone loss, meaning that your bones will weaken faster if you aren't moving or only moving a little bit.
Can you over exercise, do you think?
Definitely.
We'll get there.
We'll
So
touch
again,
base about that at the end. We have a whole slide about exercise because that's really why we're here.
so just hold your questions at the end and we'll kind of
So-
touch base on everything.
Another thing that low levels of physical activity do is they create poor physical conditions, which increases weakness in your bones and can lead to increased risk of falling in general, on top of the fact that you're already at increased risk of fracture if you do have osteoporosis or osteopenia. Things like excessive dieting or poor protein intake will also put you at risk for increased bone loss. Excessive dieting doesn't allow your body to absorb the proper nutrients, once again, limiting your body's intake of nutritional factors and increasing your risk. Chronic heavy drinking of alcohol also puts you at greater risk, as well as smoking. Smoking puts you at increased risk of osteoporosis as well. And researchers are still studying the impact of smoking on bone health from tobacco use alone, or if people who smoke have more risk factors for osteoporosis, such as the inactivity. They're not sure if it's the smoke and inhalation itself, or if it's the combination of other risk factors, such as your lifestyle, poor blood circulation from smoking. There's a lot of risk factors that smoking causes itself. So they're still doing research to
It's like a
determine that.
correlation there.
Yeah. All right. So now the signs and symptoms.
So how do you know if you have osteoporosis? So it's considered a silent disease because I don't know if my bones are thin. I'm just walking around doing my thing. So typically you will not have any symptoms in early stages of bone loss. Once your bones become weak, you might show some symptoms, including back pain, which is a sign that you might have a fracture, loss of height over time, because you're losing that bone mass and you're losing the height of your vertebral bodies in your spine. So because you're losing that height and you're losing the structure of it, you're slowly kind of getting shorter. So if you've lost You go to the doctor 1 year, the next year you go to the doctor and now you're like 2 inches shorter. That might be a very big sign that something's going on with your bones and your spine. That along goes with it, because your bones and your spine aren't as structurally sound, they can't hold your posture as well. So this is when you start seeing that not only are you losing height, you're also kind of coming a little bit forward, your shoulders are getting rounded, you're kind of stooping down a little bit. You'll see a whole change in your posture. The biggest one is you fall and break a bone. And then they find, oh, you broke it because you have osteoporosis and you fell. Muscle weakness, but this also kind of goes with lifestyle as well. If you're already living a sedentary lifestyle, you're not being active, you're not moving, and you have osteoporosis, once you start getting active and you start moving, you're at increased risk for falls, you're at increased risk of instability, you're not using your muscles, they're going to get weaker, you don't have the same level of endurance that you did before. Kind of all of this is like a self-fulfilling prophecy. It's a vicious cycle that increases your risk of falling, having a fracture, and then finding out that you have osteoporosis. Okay.
How can physical and occupational therapy improve your life with osteoporosis? So exercise, like we said, plays an integral role in the treatment of osteoporosis. Since bone is a living tissue, exercise can only make it stronger. Therapy can help you build muscle mass, improve your coordination and balance, which can help lower your risk of falling to decrease your risk of fractures. You can improve your daily function and delay any loss of independence within your life. We could also teach you safe ways of moving about, such as picking up groceries, carrying something from here to there, and working on biomechanics to make sure that you're properly lifting, that you're not risking a compression fracture in your spine, and that you're utilizing your muscles in the best way. And we can also create a specific customized program to strengthen and support your joints that's just for you. So when you come into therapy, we do like a little bit of an evaluation. We get to know you, we get to know what you like to do, what you want to do, what you can't do right now. And we work on ways to either modify it, change it, adapt it, and strengthen you to get back to doing what you love. That's really the goal of therapy. All right.
Again, over exercising the negative.
No, so we're kind of going in. So what types of exercises are best? So the biggest thing is walking. Walking is great cardiovascular wise. It's great in terms of body energy. So the recommended amount of walking is to walk 3 to 5 miles a week. Okay, a week. I know it's not. You'd be surprised. Like,
It's not every day.
I wear my watch, and it's not every day. It's not as long. You go down to Long Beach, you go on the boardwalk, and you'd be surprised. You do 1 or 2 laps. That's already like 2 or 3 miles in that one day. And this is 3 to 5 miles a week. So, you just pick 2 nice days. As the weather is getting nicer, you go out, you go for a walk, and there's a lot of really good benefits to it.
I mean, even if you think about it here, this hallway, if it was measured, is really long.
Yeah.
So even if you walked up and down this hallway in this very building where you're here right now, you'd probably be surprised that you walked not a little under a half mile, if that, back and forth. I'd be curious. That's a job for
that's your job. You gotta measure it out. All right.
But you'd be surprised.
So
When you're, I'm a classic example of everything you said so far.
Sorry.
So far. The last 2 years didn't help any. When you walk, pace matters. I mean, the more
So
if
I'm
you
a-
go at a very slow pace, you're not really getting a great deal of exercise per se.
yes and no.
Yeah, I was
so
gonna say that.
so there is a lot of research out there in terms of the speed that you're walking and what that relates to. In terms of for osteoporosis, the reason walking is such a benefit is the weight bearing on your legs. The actually putting a step and putting weight on the leg sends signals to your bone and to your body and to your brain to increase bone mass and to increase bone production. So in terms of osteoporosis, it doesn't matter the speed, it's the fact that you're putting the weight on the leg and using the legs. In terms of cardiovascular, in terms of breathing, in terms of decreasing your risk of stroke and other type of things, speed does matter for that. But I'm a big proponent of quality over quantity. You need to get to the point of just walking and walking well, and then speed comes with time. And that's kind of how we approach therapy. The benefits of just, I don't care if it takes you an hour to get from here to the door, you did it. And that's what matters. And you're still using your legs. And to me, that's a bigger accomplishment than you walking on the treadmill at like a 2.0 speed. You know what I mean? Like, it's all within perspective. It's all within what you can do. But no, just getting up on your feet is a benefit.
So another thing also, if you think about this, right? If I told you that you had to leave this building and run in that hallway, would you listen? No, none of you would. You would all look at me like I had 600 heads, like I was standing here like I'm losing my mind. The fact of you just getting out of the chair and walking is the first step to creating that routine, that ritual, that habit, that formation. It takes 21 days, 3 weeks of time, or a couple days shy, a couple days more, to really create a habit in your body.
That will-
Mhm.
3 weeks, and that's at the minimum, right? And that depends on the person. Some people it takes a little bit longer. Some people are motivated. Some people are like, exercise, what's that? I don't know what that is. Meanwhile, they're going to the grocery store doing laps. They don't even realize that they're doing exercise. They're getting up and off the couch, walking up and down the stairs 5 times throughout the day to go upstairs. Oh, I got to get this off the bed.
Oh, I gotta go
back
do the
there.
laundry. I gotta lift the laundry up. I gotta
All
do
of
this.
that counts towards movement and exercise. That's where my OT mindset comes in. Every single time you stand up from the couch, you're working your legs, right? You're putting weight through your feet, standing up, strengthening your body. So it could be as simple as, okay, every morning I'm going to do 10 sit to stands from the chair in the kitchen where you have your coffee or your tea. And you're just going to make that the habit. Do 10 up and downs from the chair. Simple as that.
And you don't realize a sit to stand is a squat.
It's the same
This
as
is,
a squat.
it's literally a squat. You're literally coming down and coming back up off the chair. You're doing 10 squats and you don't even realize you're doing it. And by
Right.
putting weight
I
through
don't
the legs, you're increasing bone mass.
Same in concept, except if you need a little break between to give your legs a little time to recover, you sit. You could do it with arms, then you're getting weight bearing through your arms. So now you're not only just challenging your legs, but you're also working on strengthening the muscles in your arms and that bone to create that density that you're lacking in osteoporosis.
Same thing, going up and down the stairs. You're going down to get laundry, you're going upstairs to get something, you forgot something upstairs. Stairs, doing step exercises, that's a huge weight. It's the same thing. There's the fact of putting pressure through your legs or through your arms sends the signal through your body to help increase bone production and helps increase that process of breaking down the bone and replenishing the bone in a shorter time period. Also, what's really good, if walking is really hard or it's really cold outside, I don't run in the winter, cycling, indoor cycling, any kind of bike ride where you're putting any kind of pressure through those legs is really good. Again, if you could do it for 5 minutes, fine, I don't care. You're getting 5 minutes of pressure on that leg. You can do it for 15 minutes. You do it, but the goal is to get some kind of pressure in through the legs and through the arms to help increase that bone mass and help trigger the body to create more bone. So we call these, the term for it is a closed chain exercise. So when you're sitting on the chair and your therapist goes, oh, I want you to do kicks. Okay, that's great. You're strengthening your muscle. This is not going to help osteoporosis in any way, shape, or form. We consider these open chain exercises. But any exercises, sorry, it's a little harder for me to scoot these days. Any exercises where you're pushing through the legs, lunges, any kind of steps, anything that you're putting some kind of weight shift into the leg or into the arms, doing like wall push-ups or anything, kind of like in the chair, kind of going like this on the chair. If you have armrests, you kind of push up a little bit. That all is considered closed chain, and all those type of exercises help increase bone mass and help increase the production of bone. The biggest thing is everyone should get at least 30 minutes of moderate to vigorous exercise 5 times a week. And again, you might be doing it at home and not even realizing it. For you, moderate to vigorous exercise is going down the stairs, unloading the laundry, carrying the laundry back upstairs, standing there for 20 minutes and folding all of it.
People don't think about their everyday function as exercise, right? But it becomes to a certain point where you have to think about all of these things in a bigger picture, a bigger lens, right? If you think walking on the boardwalk for that many miles is too difficult, think about even just going up and down your one stair, right? Like I said, 10 times that day. You know, you create small change for the greater good in your person. So in terms of getting overwhelmed by all of this information, you do not have to leave here and be like, if I don't do 30 minutes of vigorous exercise every day, for 5 days a week, I'm not going to be doing good for my osteoporosis. Create small change that leads to bigger change. Like I said, the 10 sit to stands, you could do 5 press-ups in the wall like this for your arms. You know, there's so many small things that you can do that over time will change your life. And you won't even realize, next thing you know, you're doing an hour of exercise because you added all these small things. And it's like your routine didn't even change. It was like free flowing. It all falls into place. It's like the stars align. You know, and you don't even realize like all of these small habits that you create are really good for your lifestyle. And in 4 months' time, your whole lifestyle will change because all of a sudden, every 3 weeks, you added in a new habit. And next thing you know, you're doing 30 minutes of weight-bearing exercises and you go to get your bone density scan and your doctor's like, wow, you're doing really well. It could be so simple. It sounds simple. It's easier said than done, I'm sure.
That's what we're here.
Yeah.
That's what we're here and Costa's here for.
Yeah, exactly.
Get you into those habits. Okay, so this is another prevention.
All right, so fall prevention is very important because accidents can happen, right? So in order to prevent accidents from happening or limit the chances and risk, you can modify your home environment. So there are certain things you can do that are very simple. Throw rugs, gotta go. I know everybody loves them, it's a really difficult thing, but you gotta cut the cord and throw them all out. An area rug is different, right? So an area rug is usually like an 8x10, a little smaller, a little bigger, held by heavy furniture. The only reason why I allow it is if they don't have the little fringes on the end, because those are a tripping hazard. Sometimes I have patients tape them under, or if the ends aren't curling up. Sometimes, you know, you decide to buy a rug from somewhere and it's not as good quality, it's not as heavy material, they don't sit flat. So unless the area rug is perfectly flat, has no fringe, I'm okay with it. Otherwise, a lot of rugs are a fall hazard. They could catch your toe and next thing you know, you can't catch yourself, you're falling. Decreasing clutter, just in general. So I know that I'm a big lover of like tchotchkes, I call them, little things around the house. I love to have them. I love things for my travels. I buy a lot of things, but I make sure that they are not on the ground and they're not in my line of movement. So decreasing clutter is a big thing. Night lights, something so simple, lighting the path to the bathroom. A lot of times people wake up 2-3 times a night. As soon as you start waking up more than 1 time per night to use the restroom, you are at a 50 to 65% increase of falls without osteoporosis, without anything. That is huge amount of risk. So if that's the case, make sure that there are no throw rugs, because a lot of times you wake up in the middle of the night, you're a little groggy because you're still asleep. You're walking to the bathroom, light the path to the bathroom to make sure you can see where you're going and you know exactly what your foot is stepping on. Non-stick mats in the bathtub and the shower. If you're not already using a shower chair, transfer tub bench, if you don't have grab bars, you can put one of those, they're like suction cups in the shower for non-skid, or you can actually pay somebody to put in like strips. They almost are like sandpaper, but it's also a lot more expensive than just putting the non-skid mat. Now, I know I talked about the area rugs. You guys are probably like, oh, you're crazy. It's the same thing. They usually have like 100 suction cups on the bottom and are very easy to stick and don't move because suction cups rely on a lot of like that water to actually help be held down. And they're very helpful. I've had a lot of patients that do add them into their lives, thank me about it. And another thing that's so simple is grab bars, having something to hold on to when you're stepping in and out. It's a wet surface.
The lip.
There's usually a lip or a big ledge to step over to get back in and out of the shower. So it's just something to have as an extra hold on to, just for a little extra help. And then balance training. There are exercises you can do to challenge your balance, to work on the 3 systems that are responsible for your balance and get them stronger so you could be a little more stable and have a little bit more control.
Because of course, the joy is that not only as you get older, you increase risk for osteoporosis, as you get older, your balance strategies and your balance reactions and reflexes also decrease. Not a good combo.
Like I said, don't get old. I think this is where the
That's it.
questions come in.
I have a question.
Ooh,
Lisa and I do a lot of aerobics in the pool. Does
Awesome.
that count as part of?
that
the-
absolutely counts.
That counts.
What are provides resistance? So any kind of resistance training where you're working and your muscles have to work helps.
What about Pilates or yoga or any of that stuff? Is that,
Depending on the movements, Pilates can be beneficial, but if they're all supine on your back, they are not necessarily weight-bearing exercises, but they are good for the mindfulness core connection that helps you with your balance. So it can help with fall prevention, but it's not actually as beneficial for osteoporosis unless you're doing certain movements. Yoga is different. There's a lot more weight-bearing in yoga.
yes,
Well,
So
lot
it
of
has a
times
little
they
bit
do
of
it
a
by
different benefit.
by sitting. Is that?
It would depend on the exact movements you're doing, but I'm sure some of them are beneficial in terms of weight-bearing for osteoporosis.
Because what happened is that I had an accident a few years ago and I fractured my ankle.
Sure.
And a lot of the times I can't stand for a long period of time.
Understood.
So a lot of the exercises I do it from the sitting position.
Mm-hmm.
I mean, I'll sit at the edge of my chair and I'm doing the lifting of the
Yeah,
legs.
so that's good for strengthening, but it's not necessarily going to prevent osteoporosis because it's
Yeah.
not weight-bearing. You can go ahead.
Can osteopenia be reversed? Once you have this stuff, can you reverse it to any extent?
So not necessarily. You can't reverse it, but you can prolong
The
the
progression.
progression.
You can
I'm trying to
slow
think of
down
the
the
right word.
progression.
Prevent it from getting worse.
Correct.
even though
Exactly.
You can't reverse it.
So if you have
Exactly.
osteopenia and you catch it early and you
Yeah.
start doing treatment, like in terms of lifestyle, medications, like vitamins, all of that stuff, you can actually prevent it from becoming osteoporosis by keeping it at bay. However, it's not a guarantee.
Okay.
Sometimes genetics play a stronger factor than the lifestyle itself, but you absolutely can keep it at bay.
It's funny because like my chiropractor and my doctor both think because I had COVID a year ago.
Yes.
And as a result of when I had COVID, I started to exercise. And I've been told both by my doctor and my orthopedist and not my orthopedist, and my chiropractor that they feel that I'm like exercising too much. Instead of taking 6 classes, I've been taking 9 classes. Yeah.
How do you feel?
I mean, I'm tired all the time. That's my problem. It's like
So have you
everybody
tried
out there,
to
I'm
take
feeling,
less
I'm always
classes?
tired.
Have you tried to take 6 and see how you feel?
What?
Have you tried taking less classes to see how you feel?
I've been trying.
Okay.
I think, okay, we take less classes.
Because there,
Yeah, you need to give your body
Yeah.
time to rest.
right,
You
you
need to
might not
give,
be giving yourself
yeah.
enough time to recover. Go ahead.
Somebody with osteopenia could be put on medication.
Correct.
I'm wondering, who makes the decision whether you are with or without medication?
You would
Your
go to your doctor. I would recommend starting with a primary care doctor, and then they'll do the bone mass index, the bone mass density test, and they'll kind of test you, and then they can kind of send you where they want to or put you on the medication. But
Sometimes instead of a bone density scan, they'll call it a DEXA scan. That might sound more familiar.
With osteopenia, you don't take medicine.
Correct, and that's probably more of a lifestyle. They probably just changed their lifestyle. Depends on, I guess, the severity.
yeah, but that's something I would talk to
But
your
definitely
doctor
talk
about.
to your doctor because you definitely don't want it to turn into osteoporosis.
Yeah.
Yeah.
And even simple things like vitamins, like taking the calcium and the vitamin D together could help. But again, talk to your doctor because there's certain levels of vitamin D that
Yeah.
aren't in like over the counter.
They'll typically do like blood work to check your levels as well as the bone density scan to see like what minerals your body is absorbing or not absorbing and how much of certain vitamins and stuff you should take to be able to be at that like within normal limits level,
Optimal.
whatever that means for your personal body. Anybody else?
Even exercising, like when you're sitting and you're doing toe lifts and stuff like that.
Sure.
So that's good for strengthening, but again, that's not directly going to help in terms of osteoporosis.
I have another question. Is there any specific food that you can eat that, like bananas or something like that, that has potassium, so it can make your bones stronger, or
So-
is there specific?
It's not
fruit or
specifically like
vegetable
potassium,
other
you're,
than vitamins?
sure, so you're
Yeah.
looking for foods like along the lines that have like more calcium and vitamin D. So things like kale is one of those things that's bizarre to think
Yes,
about, but
yeah.
they have very high levels of the correct vitamins that are necessary
Mhm.
to get the nutritional value. But it's all depends on how your body is absorbing it. So say you do eat kale, for example, and it has very good properties for both. If you don't have enough vitamin D because your body's not producing it, that calcium won't get absorbed and it'll basically go
Yeah,
out the
wash
same way
away.
it came in.
Yeah.
So that's
So
why you
that's why
have
it's
to
good-
touch base with your doctor to make sure that your body is actually absorbing it properly so that even though you are changing your diet, it's not all for nothing.
Yeah.
Even though it's not for nothing, you're still,
But yeah, if I may, so
yeah.
obviously take into account the, what your doctor says first, but it's all about absorption. So your dark leafy greens are gonna help with, the calcium intake. Liver tends to be the end all be all
Yeah.
for it's full of any kind of, nutrient that you could want, again.
Got a lot of cholesterol.
That's good for you, not for me, yeah.
The biggest thing is you want to have like the body always absorbs things better with protein. So always, so like the whole like keto diet and like no protein diet, I'm like very anti that. Your body needs protein actually to help absorb sugar and help absorb minerals. So you just, again, you want to talk to your doctor about how your body is absorbing things and talk to your doctor about different foods that you can eat, like liver or other proteins that aren't liver, like beans and other things, yeah, or chicken and red meat. Because, you know, there's this whole society has told you that red meat is bad for you and all these things are bad for you. You should eat like chicken and fish or have a plant-based diet. Some of that's good, but you also have to do what's best for your body. So again, I would recommend going to your doctor, seeing what your body's doing, seeing what your mineral levels
Right.
are, how your vitamins are, how you're absorbing it, and discuss trying a diet first before going to supplements or medications.
Right, and building off of that, so obviously consult your doctor first. If your doctor does approve you for supplementation, the types of supplements that you get too, so you have your capsules are gonna be the best absorption. Then you have your tablets, which are not as good, and then you have your gummies, which everybody loves, they taste great, but you're not getting the best absorption out of it. So capsules.
That's so funny.
what
Listen,
you get approved for.
My 3-year-old loves his gummies, okay? And that's how I get him
Go
his
ahead.
You
vitamins.
actually get like 20% of the actual.
Yeah.
supplement.
Sorry.
As people get older, they tend to fall. Falling is part of aging. I was wondering,
It
how
doesn't have
much
to,
of that
it doesn't have,
falling is due to osteoporosis and how much of that falling is due to other factors, aging or whatever?
That
Or
is hard
don't
to
they
say.
know?
I would say falling is more due to other issues in terms of muscle strength, balance, getting older, low vision, other things, not due to osteoporosis, but what happens when you fall is what is osteoporosis. So the fact of people falling and having multiple fractures, that's the issue. So you can do things to prevent falling, like we went over fall prevention of decreasing clutter, getting rid of area rugs, putting night lights. Vision is a big thing. Vision's one of the main things we use
Slowing
to help
down.
us with our balance, slowing down, slowing our movements down a little bit. But osteoporosis isn't causing the fall, I would say. But
It's
definitely
causing the fracture.
It's
from
causing the
fall.
fractures. It's making the fall worse. Yeah.
When I hurt my friend, when I fractured my ankle, I fractured it by, walking and I don't know what happened. I still to this day don't know if I fell or I went blacked out or whatever, but I still have the problem with my ankle, like
Yeah.
I
Uh-huh.
had pins put in my ankle, part of the
That's the
things are
way it
taken out,
feels.
but some of them are in there. Is that part of, could that be part of?
Probably most
Not
likely
necessarily.
Yeah.
So I think somebody on the Zoom has a question. Hopefully we can hear you. All right, go.
Go.
I
Are you
don't,
muted? Or is she muted? Yeah.
I think we should be able to hear. You can, I think, unmute yourself.
I have to unmute themselves.
Yeah.
Oh,
Or they could put it in the chat.
if you want, you could put it in the chat.
I'd rather, okay, I think I unmuted myself. Do you hear me now?
Yes, I do.
I have several questions. I always had good
Oh.
bone density.
Okay.
Uh, And recently it went down something like 19% in whatever a year. And they thought that was a little dramatic. It's still only osteopenia, thank goodness.
Good.
But could it be that I was, because of COVID, just lying around the house more than maybe doing the kinds of exercise I used to do? Are you seeing more of that, doctor, from
Yeah.
COVID? Are you seeing more osteopenia?
So it's
girls
not,
or
it's not
osteoporosis?
just osteoporosis or osteopenia that we're seeing. We're seeing a lot of people just general deconditioning from being sedentary. You know, like I was saying, like people weren't even able to go out to the grocery store, which if you think about it, for people who were sedentary, you don't have a choice but to eat. So people were going to the grocery store and even getting some movement. So then people were going to no movement at all. And we've been seeing a lot more of falls in general, hip fractures, knee injuries, arm fractures, things like that because of sedentary lifestyles.
Yeah, just having more difficulty getting dressed, cooking, even like just taking care of yourself. Like COVID has played
A big role.
a big role. And we have a lot of people coming in just saying that they're not able to do what they used to do. And it's
Yeah.
because
But are you seeing the kind of thing I asked you about, sudden drop in osteopenia? Because that's confusing to me why that occurred for me.
I mean, it makes sense why it happened during the past 2 years. But I mean, we don't see patients specifically for osteoporosis and osteopenia. We don't treat that. We just do general physical therapy and balance therapy.
Right.
So no one has said it to us, but I'm not surprised.
Okay, nor was I. I was just wondering why. Also, I have a daughter who's pretty thin. She's, I don't know, 117, 121, like that. And she's 50. Is that going to hurt her later? I'm happy she's trim, but I'm concerned for the osteopenia or
So they
osteoporosis.
recommend in women to get tested for bone density over the age of 65. Since genetically you already are predisposed, she's already predisposed to osteoporosis, osteopenia in the DNA. So it might be beneficial for her to talk to her doctor sooner than later and actually get tested to see if her bone density is lower and start preventing it now. There's always suggestions to rules and things like that, like, oh, when you're 65, you can go get it. However, that's just a suggestion. It's not the be all end all. If you feel that you are at risk for something, you should always touch base with your doctor, always reach out to a medical professional. And like I said, be your best advocate.
Oh, so there isn't, I once went for a test and the tech said to me, these women who are under 129 are going to be sorry later. That's why I asked that question. It's not a jealousy thing, you know. It's
No.
what-
No. Listen, everybody's
Just
different.
asking if
Everybody
that's
has,
something in the trade. No?
Yeah.
Yeah, I would definitely have her reach out to her like primary care doctor and talk about it and see if that she could get the bone density scan early, just to see if she is does have lower
increased
bone
risk.
density and is at increased risk.
Yeah,
It's-
it can't hurt.
Can I ask, I have to leave to go take my osteoporosis shot in
Oh,
about
yeah, go
5
ahead, go
minutes.
ahead. No one can be late.
I have been exercising my entire life. I play tennis 2 or 3 times a week. I do yoga. I have been jogging and walking for the last 50 years. I'm 76 years old. I have done everything. I eat okay. I'm thin though. I'm a small 5'1" thin person. It baffles me that my bone density was high for my spine. It baffles me. So I was told to go on osteoporosis, to go on Prolia shots rather than the medication because I have IBS.
Okay, that's
So that
definitely
makes
very
sense,
common.
That's that my primary physician and my rheumatologist told me to do it that way. So that's what I'm doing. My last shot that I took, and I took the bone density again, there was a vast improvement.
Wow.
Good.
Tremendous
Good,
improvement.
Sylvia.
Good.
Still, I have to go for the shots for another year or 2.
Yeah.
Yeah.
It just bothers the heck out of me that with everything I've did my whole life, this is what happened.
Tough is there is always, like I said, that genetic component that puts you at greater risk as well that we cannot control.
Yeah.
Thanks, mom and dad, you know?
I don't know. My mother was like that, this
Is
short.
good, though, in your circumstances, all of that exercise puts you actually at a slight decreased risk of falls and fracture risk due to your osteoporosis. So all of that exercise is not for nothing. One, it's prevented it from becoming worse over time to a certain extent.
I have fallen on the tennis court a few times, but I never broke anything.
Right, there you go.
I
Wait for it.
I even fell once when I was jogging, and I hurt myself, but I didn't break anything. I just, my skin. I guess.
These are okay. No fractures, ladies. None of that.
Yeah,
And men.
yeah. You guys.
Okay. Thank you very much. I have to go get my shot.
You're welcome. Good luck.
Bye, Sylvia.
Bye, Arlene. Bye.
Bye. Love to your daughter. I have 2 more questions, if I may. The people sitting there got more questions. May I ask 2 more, or do you have other people in Zoom who are waiting?
You can ask
Yeah,
another
just
question. We
one
just had
question,
somebody
yeah.
jump in, okay? One
Okay,
second.
fine. Would MS be one of your autoimmune diseases? You didn't mention that one in your paragraph.
Yes, MS
Okay.
would be one.
And what meds besides things like prednisone would be predisposition for,
So it depends, like certain medications for like
hormone medications.
right, like so medications like for your thyroid, medications if you were like a breast cancer survivor and they put you on a pill, like a 5-year pill afterwards, like one of those pills, they put you at increased risk. Things that I said thyroid medication. There are a lot of things that they use.
Like
IBS.
Are
That
you
has
saying
side
thyroid like Synthroid can put you at a risk for osteoporosis? I
It's
never heard that.
possible. It's possible.
Wow.
It is possible, but it's not necessarily 100% that it's going to
Yeah.
happen because you're on it. That's just why it's recommended to talk to your doctor to make sure.
Gotcha.
If they thought it would be of risk to you to put you on it, they probably wouldn't have put you on it in the first place, or they would give you something to counteract the side
Again.
effects to weaken bone.
You have to weigh the options here. Like if you have a thyroid issue, you're on Synthroid, you need to be on that Synthroid.
Correct.
Like
I
having.
love that Synthroid, 20 years already. Okay, thank you. I'll defer to other people. Thank you.
Thank you so much.
There's a connection between Synthroid and osteoporosis?
No,
Not
not
necessarily.
necessarily, no.
All
You have
medications
another
have
connection
side
Yeah.
effects.
So-
Without that one.
Yeah.
Yeah.
So she wanted me to explain what a compression fracture is.
Oh,
So
sure.
in your spine, the way the spine is made up is your vertebral body, which is like the big part of the spine. And you those things that kind of stick out on the side, the transverse process. So within the vertebral body, that's kind of the stability that holds it up. And in front of it's the little circle of bone, and that's where your spinal cord goes in, and then the nerves come out. So you have like the big body, you have like a little circle of bone where the spinal cord goes in, and then bone that comes out to protect the nerves that also come out. When you have a compression fracture, the big part of bone, the vertebral body, that's what fractures. It kind of compresses down and kind of crunches, for lack of a better way of saying it.
Right.
So
So
usually what happens is when that happens is you lose the stability of the spine. It can also compress some of the nerves that come out of your spine, causing some back pain. It's usually in the upper thoracic spine because that's where your ribs are. So it causes a lot of like rib pain, bleeding rib pain that comes around. So that's what it is. So there are procedures, medical procedures they can do if it's a really bad compression fracture. Well, they actually go in. Interventional radiologists will go in and actually kind of put like a cement or a mortar into the vertebral body to kind of build it back up and recreate that structure and stability.
as long as there's room, exactly.
Yeah,
They
as long
actually
as
can
there's
put
room, yeah.
spacers,
Yep.
which are little tiny balloons in your spine to create space. When you have a fracture,
chiropractor
to
should
get an
not touch a
adjustment,
fracture.
you should not get
No.
adjusted with a fracture.
It's unstable.
Yeah.
You never want to go
You
to a
wanna be
chiropractor with
healed.
a fracture. It's got to be healed.
I've been on Prolia for about a year and a half now,
Okay.
and I'm going, I don't know, who's helping or not, I'm going for bone density, I think next month.
Ooh.
And I'm wondering, I think I got worse, but how long can you be on Prolia? I could ask the doctor, but I'm wondering if you have.
I think a while.
Yeah, you can be on a while.
I went off, I had to go off it. I was
Yeah.
on it for over 5
Yep,
years. And
I was
my
gonna say.
Osteoporosis got better and became osteopenia.
Really?
And I was told that my treatments were over and I could not take any more Prolia. And now my osteoporosis is back. It is not as bad as it was.
What are they doing for it?
Well, they told me to go see a rheumatologist,
Of course.
Is that a good one?
which
Oh, all
I
right.
need
Good to know.
because I did not follow through because I reached a point where I said, I can't deal with this. I got too many other things to deal with,
Sure.
which was the wrong thing to do and a bad attitude. And now my attitude is changing because I pulled myself up once again by my bootstraps. But this has been for me a battle that is going to be a continuous one.
Mhm.
And I have to be forgiving of myself when I backslide.
Of course.
Yeah, you're only human.
We
all-
are creatures of
Well, I
habit.
have
Yeah,
it's okay.
I believe I had a good, strong bone structure because for 35 years, or I should, 35 years, I worked where I did a lot of walking and was constantly on my feet, running back and forth as a nurse. You don't sit around much.
We
Makes sense.
understand.
Yeah.
And I retired with the diagnosis of breast cancer. And was put after surgery and chemo and radiation, was put on estrogen suppressants as
Mhm.
well,
And that's,
which
Oh.
lasted 10 years and did not help osteoporosis
The
No,
plot
that was-
thickens.
develop.
yeah.
Yeah.
So the fact that I, in the last 2.5 to 3 years, became a couch potato and a vegetative person,
Yeah,
It was hard not to,
It's
honestly.
okay.
it was very difficult not to. And now you're telling me I have to walk 2 to 3
Well, you can come walk
miles
with
a
us. You
week.
can come see us and hang out with
It's hard
us.
to know when that happens
That's what I'm
done.
saying. Like
I
it's
feel
it's
better
not
because
a
I do
it's
walk up and down the stairs in my
it's a
house little
marathon. It's not a
slowly.
marathon. You know, I mean, it's
No,
not a sprint, it's a marathon.
marathon.
It's all about the long game.
Progress, not
Yeah.
perfection.
You
Exactly.
did say something though about balance, which I also have a problem with the result of chemo.
Yes.
And you said something about there being 3 core
So,
issues with that.
3 systems in your body.
How is your abdominal core muscles?
well, there's 3 systems that help control our balance. So you have your vision, see where you're going, your sensation, feel where your body is, and then your vestibular system, which tells you where your head is in space. And those 3 systems are constantly giving your brain information. Your brain then absorbs that information and sends out the correct reflexes to help you move in your environment. And then there are other things like your core and strength that also help with balance as well, because if you trip and fall or you're a little bit more sturdier and stronger, that's going to help you.
Yeah, that's
Yeah.
becoming a problem now, probably because my musculature is so weak.
One day at a time, little things at a time will
I
help.
have to tell you that my calcium level, my vitamin D3 level are all sky high.
Okay. That's
Good.
not bad.
Good. I know.
And I hate taking all those pills. every
Oh.
day.
I feel you.
They're in- Yeah, I was gonna say. I'm like, she's very familiar.
Stay with the Prolia,
Yeah.
it does work.
I would love to walk, but.
Is there, I'm sorry, is she finished? I don't want to step on her questions.
Vertebrae is so
Okay. Is,
I couldn't have the cement or the
Space.
gel or whatever they put in
Mhm.
them. So I went for injection.
Did they help?
I went to 3 of them.
Sure.
What is it called?
Lidocaine.
No, when you're having a baby.
Oh, an
Oh, an
epidural.
epidural,
Sorry.
yeah.
Yes.
Epidurals.
Yeah, I
Okay,
was
so
talking about the
now
actual
I'm
medication.
Oh, you're having a
starting-
baby, congratulations.
Thank you. I'm a
No
wonder.
shower.
I'm a wonder. So now I'm going for a block.
You make a party?
A nerve block.
Ooh, a nerve
Okay.
block. Okay.
That
Good
worked
point.
for almost 3 weeks.
Okay.
That is
Now
not
they
that
want
long.
to do another one of the block. And then there's another procedure called faucet or facet
Mhm.
when it's ablation of the nerves.
Right. Have you been to therapy at all for the fracture?
I would highly recommend you try that before you do
Yeah,
all of that
'cause-
injections.
Because even though the bone is kind of come down and you don't have the same stability, you'd be surprised what muscles and tendons can do to help
Support
to
that joint,
support the joint and kind of take over and provide stability so it's not pinching on the nerve so much.
I'm gonna try this facet. This sounds really interesting. It helps me. So I said, well, what if that? If it stops working, then what? Well, we can do it again. Oh,
I would get a second opinion also, just make sure you're not just going with the same person, because,
one's an orthopedist and the other one is pain management.
yeah. I
The
would get a
fact that
yeah.
the 3 injections didn't work, the
And the
nerve
nerve block
block
didn't
lasted
work.
only 3 weeks, that is not
Well,
within
they
the
said
norm.
That was good. That it lasted 3 weeks.
Nerve block should last like 3 months.
Yeah,
My insurance paid for it.
Oh.
yeah.
Prolia is not inexpensive.
Yeah,
You
yeah,
have to get going too. Yeah,
Not
so you guys,
No,
you have a
it's
chance.
insurance paid for it.
Thank you. Thank you guys so much for coming.
I have a quick question.
Appreciate it.
I have one more question. Is there a correlation, any correlation between taking calcium and calcification in the arteries?
So in terms of taking calcium and calcifications, you have to make sure that you're taking the right dosage and that your body is absorbing the calcium and has enough vitamin D to absorb it. That's why we recommend doing the blood work so that you know where your levels are at, so you can make sure that you're not overdoing the calcium, because you can actually get calcium deposits in not just your heart, but in your joints as well. So that's why we always recommend getting the info from your doctor to make sure that your levels are appropriate so that you're not overdoing it and things like that. So they're just wrapping up the lecture. So if you guys have any questions, you'll have access to the resources and this lecture through recording. And you can contact us at any time and ask questions, okay?
Thank you.
So thank you so much for coming. We really appreciate it. It was a pleasure to meet you. I hope we answered as many questions as we could.
Thank
Have
you.
a good day.
I know.